Today we'll review nursing responsibilities for infants on bubble CPAP. First, you'll want to gather all of your equipment and set your TPs up. You can see me setting my PIP to 20 and then my PEEP to 5. Next, you can see me setting my suction up to 80 to 100. Ensure that you have the following supplies set up at the bedside: a 5 to 8 French gastric tube, 2 10 to 12 mLs enteral syringes with one left open to air, your nitrazine paper, and then your Duoderm and Tegaderm cut to size. Ensure that the infant is placed on cardiac leads and pulse oximetry. Next, prepare for inserting a gastric tube. Position the infant supine with the head of the bed elevated around 30 degrees with the neck slightly extended. Place a small firm roller towel under infant's shoulders to support the head, and suction the infant as needed for clearing the airway. Measure the tube from the mouth to the earlobe to midway between the xiphoid and umbilicus. The duoderm under the mouth towards the right or left cheek and gently insert the OG tube to the pre-measured mark. Firm placement by oscillating the stomach and injecting 2 mLs of air. Aspirate the gastric contents and test with nitrazine paper. Secure the OG in place with Tegaderm. Next, assist RT with applying the appropriate interface. We're using the flexi-trunk interface, which consists of the nasal tubing, prongs or mask, and infant bonnet. First, measure the infant's head circumference and choose a snug bonnet based off of those measurements. Slip it over the infant's head, covering the ears with the back at the base of the neck and the front just above the eyebrows. We'll be keeping a lockbox in the NICU that includes a sizing guide for the prongs and mask, and various sizes for the bonnets and headgears, as well as the mask and prongs. The bonnet can be changed as needed if it gets soiled, and it can be tied for securing. The flexi trunk comes in 3 different sizes of 50, 70, and 100 mm, and it comes with foam strips that can be teared off, but please do not throw them away. The masks come in a small, medium, and large, and the prongs come in a variety of sizes. Select the appropriate size prongs or masks using the sizing guide. The mask should not touch the edges of the nose, septum, or eyes. Prongs should fill the nares completely without stretching the skin. Choose a correct length of tubing using the shortest possible. Tubing should not extend over the forehead. Connect the prongs or the mask securely. For prongs, squeeze the sides to expose the grooves and insert into the tubing fully. Remove the tear-off strips as needed to adjust the nasal tubing angle for an optimal seal. The tubing should be parallel to the infant's face, not slanted up or down. Should fit comfortably around the nose without occluding the nostrils, touching the septum, or covering the lips or reaching the eye. Secure into place, hook the clips on the side of the bonnet to the gliders.